My name is Huey McDaniel. I am a vascular surgeon, fellowship trained and board certified. I've been in practice for approximately 21 years, and I love what I do. I went to Tulane to undergraduate, then went to University of Alabama to medical school. I went to Indiana for my general surgery training, and then did a 2-year vascular fellowship at Chapel Hill, North Carolina. When I first came out in practice, I was in Reno for approximately 4 years, then moved to Mississippi for a total of 8 years, was in the Panhandle of Florida for another 8 years, and I've been here in Vegas for a year. As a vascular surgeon, I specialize in minimally invasive approaches to vascular disease. That may be arterial, venous, aneurysmal, cerebral vascular, renal vascular, mesenteric, which has to do with blood flow to the bowel. Vegas Vascular is the largest fellowship-trained, board-certified, specialized group of vascular surgeons currently in the state of Nevada. We have the option of treating something minimally invasive as well as open. Therefore, we have a lot of tools in our tool bag, and for that reason, I think we have a different perspective on the best approach to treatment of vascular disease. In some cases, something does better with a minimally invasive approach. In other cases, the best long-term result for the patient is going to be an open surgery. But we also have the opportunity to do hybrid, in a combination of minimally invasive and open to decrease the size of the surgery on a patient and maybe give them a third option as well. And we're really the only group that can do that. As far as venous disease goes, probably 40% of folks in their 40s have venous insufficiency or venous disease. 60% of the folks in their 60s, 80% of folks in their 80s, it is very common. Arterial disease is something that people tend to know that they have a problem because they'll end up with pain in their leg when they go to walk a distance, for instance, and they don't know what's wrong, but they knew that something is wrong. In the case of cerebral vascular disease, that's a little scary. Folks need to be seeing a vascular surgeon about cerebral vascular disease because most people don't know that they have a problem until they have a stroke. In fact, 6 out of 7 people, the first indication that they have a problem is when they have a stroke, as opposed to 1 out of 7 actually having some sort of heralding symptom that something is wrong, like loss of vision in an eye, weakness or numbness in an extremity. Vascular disease is all over the body, and we treat it everywhere except for on the heart and inside the head, so everything but the hearts and the minds. We try to be complete specialists when it comes to treating patients. We don't have to send somebody out to get treatment for open surgery if we can't do it minimally invasive. When we see somebody, we don't only have the option of doing open surgery. So I think we offer more than what you may get from other people that do vascular work. If you want more information, please look at our website and feel free to call the office and schedule a visit. We'd be more than happy to see you.